Hey friends! Before we dive in, don't forget to hit that subscribe button so you won't miss any tips on staying strong, healthy, and pain-free. Today, we're going to talk about something that can really affect your daily life: hip pain. You might not realize it, but hip discomfort is more common than most people think. And understanding exactly where it hurts can give you big clues about what's causing it and how to fix it. Hip pain can sneak up slowly over months, or sometimes hit suddenly after a workout or long period of sitting. Knowing what's behind it is the first step to relief. Hip pain can show up in the front, side, or back of your hip, and pinpointing the exact location is the first step toward figuring out what's going on and taking the right steps to feel better. Think of it as decoding your body's messages. The more precise you are, the easier it is to address the problem. In this guide, we're going to walk through the main causes of hip pain, explain what they feel like, share practical tips to manage or prevent them, and even give you a few friendly reminders to keep your hips healthy for the long term. Front hip pain causes. Pain in the front of your hip can come from a variety of sources, ranging from muscle strains to deeper joint problems. Recognizing the exact symptoms is key to getting the right treatment, avoiding aggravation, and helping you return to your normal activities faster. One of the most frequent culprits is hip flexor strains. This type of pain usually runs down the front of the hip and can make simple movements like lifting your knee, climbing stairs, or even getting up from a chair feel uncomfortable. Hip flexor strains often occur in athletes, runners, or even people who sit for long hours at a desk. The good news? Gentle, progressive strengthening exercises like leg lifts, lunges, or even light hip stretches can really help improve flexibility, reduce pain, and restore mobility over time. Pairing that with some light stretching or a few yoga moves can make a noticeable difference in daily comfort, and it can also help prevent the problem from coming back. Another potential cause is a hernia, which often produces pain in the crease of the leg. This pain tends to worsen with bending, lifting, coughing, or straining, and sometimes a small bulge appears under the skin, more visible when standing or coughing, but often disappearing when lying down. Hernias shouldn't be ignored because they require proper medical evaluation to prevent complications. Early diagnosis and treatment can make all the difference in recovery. Sometimes, what feels like front hip pain is actually referred pain from the lower back or pelvic joints. This type of pain can be harder to pinpoint, is usually located higher than the hip itself, and doesn't worsen with coughing or bending. If you notice discomfort in your lower back or pelvis along with hip pain, consulting a chiropractor or physical therapist can help address the root cause rather than just masking the symptoms. Simple adjustments, mobility exercises, or targeted stretches can often provide significant relief when the pain is stemming from these underlying issues. If the pain is sharp or pinching deep in the hip, especially when bending your knee past 90 degrees, it often points to deep hip socket pain, which usually involves the joint itself and can be caused by several conditions. For younger adults between 15 and 45, hip impingement is quite common. Extra bone growth along the hip joint causes the bones to rub together, which can gradually damage the joint over time. Another possible cause is a labral tear, where the ring of cartilage around the hip joint gets damaged. Labral tears may cause clicking, catching, stiffness, or even a feeling that the hip is locking up. Both conditions usually require a medical evaluation for proper diagnosis and management. For people over 50, hip arthritis is very common. This involves the slow breakdown of cartilage in the hip joint, causing progressive pain, stiffness, and sometimes a noticeable reduction in range of motion. Many people notice the stiffness first thing in the morning or after sitting for a long time. Pain often worsens with activity, and while sitting can temporarily relieve discomfort, too much sitting can make stiffness worse when you try to get moving again. Everyday activities like putting on socks, climbing stairs, or getting out of a chair may become increasingly challenging. Adding gentle mobility exercises and low-impact activities like swimming or walking can really help keep joints flexible. There are also rarer causes of front hip pain, such as hip dysplasia, where the hip socket is unusually shallow, leading to premature wear and tear, or necrosis, where bone tissue dies due to insufficient blood supply. These conditions usually require advanced imaging and specialist care, and early intervention can make a significant difference in outcomes. Side hip pain causes. Pain on the side of the hip is extremely common and often points to issues with the muscles or tendons around the hip joint. This type of pain can be particularly noticeable when lying on your side, walking, running, or climbing stairs, and can interfere with sleep or exercise routines. Tendinitis of the outer gluteal muscles, often called greater trochanteric pain syndrome, is one frequent cause. You'll usually feel pain directly over the bony lump on the side of the hip or in the surrounding muscles. Interestingly, this type of pain is more common in women, partly due to differences in pelvic width. Weakness in the outer gluteal muscles is often the underlying culprit. The most effective long-term solution: targeted exercises to strengthen these muscles, combined with stretching, gentle massage, and sometimes heat or ice therapy. Over time, this approach can significantly reduce pain, improve hip stability, and even prevent other types of hip or back problems. Another cause of side hip pain is iliotibial band, ITB syndrome, which produces a snapping or flicking sensation as the ITB rubs over the hip bone. This thick band of fibrous tissue runs down the outside of your thigh, and tension here can irritate surrounding structures. Releasing tension with stretches, foam rolling, and soft tissue work is key to relief. Maintaining flexibility in this area is also a great preventive strategy, especially for runners, cyclists, or anyone who spends a lot of time on their feet. Back hip pain causes. Pain in the back of the hip, particularly in the glutes, can be debilitating and affect daily mobility. Piriformis syndrome is a common culprit. It creates a deep ache that worsens with prolonged sitting or certain sports activities, caused by a tight piriformis muscle irritating the sciatic nerve. This can lead to pain, numbness, or a pins and needles sensation radiating down the leg. Stretching, releasing tension, and strengthening the surrounding muscles are essential for managing this condition effectively. Even simple movements like gentle seated stretches or foam rolling can make a huge difference over time. Low back. Joint irritation can also cause pain in the back of the hip. This type of discomfort is often accompanied by back pain itself, and movements like standing, bending, or twisting can make it worse. Addressing the underlying back issue is crucial because just treating the hip alone won't provide lasting relief. Core strengthening, posture awareness, and mindful movement patterns often help reduce the strain on both the back and hips. Posterior. Impingement occurs when the leg bone and pelvis contact abnormally during certain movements, causing a pinching sensation at the back of the hip. Modifying your activities, improving hip mobility, and avoiding extreme ranges of motion initially can help reduce pain while you strengthen supporting muscles. Finally, a hamstring tendon strain can lead to deep, localized pain where the hamstrings attach to the pelvis, especially noticeable while sitting. Gradually strengthening the hamstrings and incorporating gentle stretching is key to recovery, preventing future injury and regaining full function. The common thread: gluteal muscle weakness. One consistent factor across almost all hip pain conditions is weak outer gluteal muscles. These muscles are crucial for stabilizing the hip and pelvis during movement. When they're weak, other structures take on extra stress, often leading to pain, compensatory movement patterns, and even longer-term mobility issues. Whether your discomfort is in the front, side, or back of the hip, strengthening your glutes is often a central part of the solution. It improves overall stability, reduces strain on surrounding tissues, and helps prevent future problems. Pairing glute strengthening exercises with proper stretching, posture awareness, and regular movement can make a big difference. Consulting with a healthcare professional ensures you target the right muscles safely and effectively. Even small daily efforts like glute bridges, clamshells, or mini band walks can add up over time. So, if you found this guide helpful, don't forget to subscribe for more tips on staying active, healthy, and pain-free. And before you go, make sure to check the description for helpful products, tools, and links that can support your hip health journey. Take action today. Start small, move regularly, Strengthen those glutes and be consistent. Your hips will thank you, and your overall mobility and energy will improve more than you might expect.